Hello and welcome to Rising Kashmir. Today we are in conversation with a consultant psychiatrist from Department of Psychiatry, Dr. Junaid Nabi. Dr. Junaid, welcome.
Assalamu alaikum.
Sir, please tell us what is the impact of closure of schools on students?
Because of the closure of the schools, the main thing is that that students are having ample of time, and the way they used to spend time outside with their friends and with their colleagues, they are not able to go outside, and they are not able to engage themselves with them. So because of having ample amount of time at their disposal, they are used to using more of internet and seeing things which are not important to them, and because of that that stress level has increased, and they project it with frustration, anger outburst, restlessness, not sitting at one place, and parents usually complain that they are not listening to us, and usually the way they used to comply to our guidance or our whatever advice, now they are not helping it. So that impact is having a deterrent effect on their...
And what a parent should do in such a situation? How should he handle his...
So instead of letting their children get used to more of internet, they can they can just divide that time, and they can just spend more time with their children. They can play indoor games, they can play outdoor games, they can just watch some what is a need of a student according to their age. They can just sit with them and they can just discuss things with them.
Are these online classes helpful?
I think it is better, instead of not having any means, at least it is helping to an extent. Not to that extent the way they would have helped if they would have been going to schools. But at least they are getting some dividends, some productivity because of these online.
You talked about the internet, but we have a reduced speed of internet over here.
Yes.
So does that have a role on the psyche of a student?
Still it is available to every student. Better than getting used to internet. It's better if they put themselves into games, other extracurricular activities like painting or whatever hobbies a child will have. So if a parent will help a child in that will be more helpful.
But many parents themselves are going through a difficult phase this time due to the stress, mental stress and all those things. How do you think they can cope up with their children? Such parents, how?
See, I think 95% of population was stuck, except doctors and other essential commodities. See, the thing is, elderly understand things in a better way. They have that mental makeup that they can face everything properly. Instead of a child whose brain is just developing, and they don't have so much of liberty and so much of wisdom to understand things. That way, that adult can help himself better as compared to a child.
Dr. Saab, there are many new habits that have been developed due to this COVID, like washing of hands every 20 minutes. Do you think it's going to play on the mental stress of the person?
See, washing of hands is one of disorders.
Not only washing of hands, like washing of hands, there are n number of things which we usually did not used to do.
See, the main thing is because of lockdown, everyone is stuck, and this is really will play a effect on the mental state of a person. Everyone is going through depression, the sadness of mood, sitting at one place, not having pleasure in things which they used to have. There will be restlessness, anxiety. So that is a component which is happening to a person because of staying at home.
But how can we tackle that?
Main thing is, see, I will tell you few things how to do it. Most important thing is we should be away from news. Most of that knows, and if I'm not saying that we should not be up to the general knowledge, and we should not be knowing what is happening, but we should be seeing the things which are very reliable. Second is we can do exercises, meditation, yoga, some relaxation exercises like breathing in and breathing out. Third will be one should have a very adequate sleep from 6 to 8 hours. Something like what I told you, meditation, or something called spiritual, offering prayers, or other religion will follow their own aspect. So they are very helpful in that aspect. And regarding married people, they can help their spouse in their daily activities. Some are having, some are having those hobbies which they never used to fulfill because of stringent and less amount of time. So they can just flourish on to those these hobbies.
Social distancing has also come into play. Do you think it's going to affect our social, cultural heritage of Kashmir?
It is. The way we used to communicate. See, I will tell you an example of this COVID. Because of this, there is so much of stigma. And everyone is saying that if a person is has come positive, we'll not talk to a person, and we will just refrain from talking to their family as well. So that will having an impact on their psyche as well. So we should not do that. We have to take all precautions. We can just talk to them on phone. We can have this. Usually we have those adjacent houses, so we can talk through windows that used to be in the beginning itself. So these are helpful. But if we remain away from these people, then it will be having an impact.
Due to COVID, we have seen a number of cases, the rise in the domestic violence cases. Do you think it can lead to increase in the divorce cases as well?
I have gone through many cases like this. No, there are so many these domestic violences. The main problem is, and the main reason behind things will be that people are having so much of time. They were not actually ready to be together for such a long time. It's like for days together they are staying together. Now they are understanding lacunae, flaws in one another's partners. So what I mean to say, it's better if they engage into something productive work.
What will be your advice to the couples?
Is better if they do something which is good. Like if wife is cooking something, husband can go and help him in that. If they are having a kitchen garden or a garden, they can just help in that, or they can help wife in other chores as well.
If there is a death in our neighborhood due to COVID, how can we deal with such anxiety?
Main thing will be, we have put our numbers on social media and all, so they can contact us if they are having anxiety, and we are all the time available. Our department has put most of the consultants and most of the doctors' numbers on social media. They can contact us, and people who are nearby, they can come and visit our hospital. But still, I will say that it's better if they consult us on phone.
Doctor, my last question. There are also a number of cases of dementia, elderly people who have dementia. How can the family tackle such patient in these times?
The main problem is that the caregiver burden. So we are preparing. In fact, yesterday we were talking, a few doctors were talking together, and we had come up that we'll make some checklist. What are the do's and what are do nots in that
for the dementia
patients, so that we can help them. See, there are important things like there is memory impairment. So for that, we can mostly give medicines, and there are some psychological managements we can tell them. So there are different remedies which we can help a patient of a dementia. So that way they can be helped. So I'm again telling you that we have put our numbers. If they are having some problem, they can help us. They can take help from us.
Dr. Saab, thanks. Thanks, Doc, for
Thanks so much.